Hello everyone. We have a 51-year-old man and he has been admitted in the hospital due to renal failure. His past history is significant for recurrent episode of bilateral flank pain over the past several years, long history, as well as nocturia 2 to 3 times per night for the last 10 years. Oh well, one thing is notable, is a long history. BP is high. Liver is also large. A mass is felt at the right flank on deep palpation. Most likely diagnosis. Beautiful question. Answer is polycystic kidney disease. This man has autosomal dominant polycystic kidney disease, what we write as ADPKD. If you see the specimen, you can see multiple cysts are there in both the kidneys. Polycystic kidneys. Well, what happened? Well, it's autosomal dominant. It means that it runs in the families. So you can see normal kidney enlarging, ultimately kidneys totally distorted, normal hyperfiltration, impaired, and failure. Beautiful. And look into this. It was present at birth. The problem started when the impairment in the age of somewhere in the 45 to 50 year, 30 to 50 year, when the patient has problem of renal impairment is there. Well, ADPKD is one of the most common heritable disease of the kidneys. Account for 10% case of dialysis patient. Patient often have hypertension and palpable kidney on examination. His BP is high and mass is felt at the right flank on deep palpation. But why right? Why not left? Please note, enlarged right kidney is easier to palpate because it's less lower than the left kidney. That's why right kidney is palpable. Liver may be enlarged due to cystic involvement. Liver is enlarged in our case also. Okay, liver is enlarged. Now, I have a question for you. Stop the video, write down the answer. Liver may also have a cyst. But now the question is, what finding we can see in colon and in the cerebral vessels? Stop the video, write down the answer. Well, as far as colon concerned, you can see diverticulosis. As far as cerebral vessel, you can get Berry aneurysm, which can rupture and can lead to subarachnoid hemorrhage. Diverticular disease. This is Berry aneurysm, which can rupture and can lead to subarachnoid hemorrhage. You can see various aneurysm are there. Well, option A, horseshoe-shaped kidney, is a congenital abnormality that can cause complications such as uretropelvic junction obstruction, renal stone, vesico-ureteric reflux, and chronic UTI. Horseshoe kidney does not cause pain and it will not be palpable. This rules out. Look, this is the horseshoe-shaped kidney. You can see urography. What about nephrolithiasis? Option B is a common complication of polycystic kidney disease. It occurs in 20% patient of the affected patient. They cause pain but would not induce a palpable renal mass unless caused by hydronephrosis. Hydronephrosis can lead to renal failure. And moreover, the problem is above having not been chronic in nature. Patient has problem in the last 10 years. This is not a problem of 10 years. Temporal profile rules out. Papillary necrosis due to ischemic necrosis of the renal papilla. The important cause of analgesic overuse, the most common cause, diabetes, infection, urinary tract obstruction, hemoglobinopathy like sickle cell anemia. They would not be associated with palpable kidneys. Now, again, I have a question for you. Stop the video, write down the answer. What is the X-ray finding of papillary necrosis? You can see classically ring sign. Don't forget. Ring sign. Hooks. Okay. But cortex are no loss in cortex, only papilla. Option E, renal cell carcinoma does not occur with the increased frequency of patients with ADPKD as compared to the generalized population. Also, there is no other symptom as weight loss or loss of appetite, which are common in renal cell carcinoma, but they are not present in our patient. Renal cell carcinoma alone would not give rise to renal failure. Okay, and moreover, this does not go for 10 years. 10 years is a long history for a RCC. This the RCC, it is entering the renal vein. Golden line to remember, ADPKD is a heritable form of renal disease, is also dominant, characterized by multiple renal cysts. Cysts can be there in the liver also. Intermittent flank pain, hematuria, urinary tract infection, and nephrolithiasis. Thank you very much.